Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Many people have experienced moments of uncertainty when it comes to understanding addiction and its complexities. Welcome to today's segment where we'll explore the topic of substance use disorder, often referred to as SUD. This discussion is intended for educational and reference purposes only and is not medical, psychological, or professional advice. Substance use disorder is a medical condition characterized by a range of cognitive, behavioral, and physiological symptoms. These symptoms indicate that an individual continues using a substance despite facing significant substance-related problems. It's important to note that an SUD is diagnosed based on specific criteria, and not all substance use constitutes an SUD. It doesn't automatically mean that someone is physically dependent on a substance. There are common misunderstandings surrounding this topic. For instance, many believe that SUD only applies to illegal drugs or severe addiction. However, it can involve legal substances such as alcohol or prescription medications and exists on a spectrum from mild to severe. It's not solely defined by extreme dependence. Another misconception is that regular substance use, especially among teenagers, automatically means someone has an SUD. In reality, regular use does not meet the diagnostic criteria for an SUD unless it leads to impaired control and negative consequences. Also, it's often assumed that having an SUD reflects a moral failing or a lack of willpower. In truth, an SUD is a diagnosable medical condition that involves complex brain changes and various environmental factors. Understanding the criteria for diagnosing an SUD is crucial. The diagnosis is based on guidelines outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. These criteria may include taking a substance in larger amounts or over a longer period than intended, having a persistent desire to cut down or control use without success, and continuing to use the substance despite ongoing physical or psychological problems. If an individual meets at least two of these criteria within a 12-month period, they may be diagnosed with an SUD. It's also essential to clarify what an SUD does not mean. For instance, experimental or occasional substance use, particularly in adolescence, does not automatically qualify as an SUD. There must be a pattern of use leading to clinically significant impairment or distress. Furthermore, not all individuals who use substances heavily have an SUD. Heavy use can be problematic without fitting the specific diagnostic criteria for impaired control and significant negative consequences. Lastly, an SUD is not an irreversible condition. While it is chronic and can relapse, remission and recovery are not only possible, they are common with the right support. Understanding these nuances matters for recovery communities and public health conversations. It fosters a more compassionate view of those struggling with addiction and highlights the importance of support systems. For those considering careers in substance use disorder counseling or behavioral health, knowledge of these topics can help prepare them for their roles in supporting individuals on their journey to recovery. Topics like this are often explored in addiction counseling education. Institutions such as InterCoast colleges offer programs that include discussions about behavioral health and recovery support. If you'd like to learn more about education pathways in this field, you can visit intercoast.edu. Thank you for joining us today as we navigate the complexities of substance use disorder.
If you or someone you care about is struggling with mental health or substance use, help is available. You can contact the SAMHSA National Helpline at 1-800-662-HELP. Available 24 hours a day, 7 days a week, free and confidential, in both English and Spanish. You can also call or text 988 to reach the Suicide and Crisis Lifeline anytime. And if you're looking for treatment or support services near you, simply text your 5-digit zip code to 435748. That's HELP for you to receive local resources. Reaching out is often the first step toward recovery, and support is available whenever you're ready.